Hello students, we will discuss an interesting topic today, case discussion. We will just see what is this, then you can have the idea what this condition is. All of you know this is in right hand actually, left hand actually. You can see the black dry area in the middle finger. You can see that it is a typically gangrene in the upper limb. So this entity is gangrene left middle finger. It's a feature of upper limb ischemia. So there are the two causes, upper limb ischemia, two types are there, acute and chronic. So what are the causes for acute upper limb ischemia? Two conditions, embolism and trauma. Again, both are mainly occurs in the brachial artery. Embolism occurs in the bifurcation of the brachial artery, and trauma also common in the brachial artery, elbow, in the arm and so on. So both are brachial artery sites. These are the two common causes for acute upper limb ischemia. What are the causes for chronic upper limb ischemia, which is again common? All these conditions, atherosclerosis, arthritis, vasculitis, Raynaud's phenomena, episodic vasospasm, especially in cold, in different causes, different vasculitis, different conditions can cause, common in upper limb, common both hands, common in females, commonly bilateral, can involve lower limb occasionally. So all these things are the features. Basically some other conditions will be there as a underground etiology, in many situations other than Raynaud's disease, which is vasospasm as a cold sensitivity actually. So thoracic outlet syndrome also can cause upper limb, one of the common cause, where surgically correctable one. Cervical rib is one of those causes, thoracic outlet or inlet syndrome. Cervical rib is one of the causes for thoracic outlet. There are so many other causes. It's a main question for you. Please go through the book, go through my SRB manual of surgery. So this is the acute, chronic. Acute embolism, trauma. Both are brachial artery. Chronic, these are the different causes. So what are the features? Claudication in the arm and forearm. How it is suggested? Patient can't lift the bucket, can't lift the weight. Then some basic upper limb exercise causes pain in the arm muscles and forearm muscles. And features of ischemia, if compared to opposite side, wasting will be there, skin changes will be there, radial artery will be feeble, ulnar artery will be feeble, brachial artery will be feeble, and digital ischemia, and sometimes gangrene like this will be there. Wasting, both thenar and hypothenar. Eminence wasting is very, very typical. If it is unilateral, other side you can compare wasting. Both forearm, dorsally also you have to compare. Between the intermetatarsal spaces, there will be wasting, intercostal, interosseous muscle wasting will be able to see. Both here, dorsum also, flank palmar aspect and dorsal aspect, both you can visualize properly, inspect properly, then you can see, identify the wasting. And absence of pulses or feeble pulse, digital ischemia and gangrene. And what are the other features? Drop in systolic pressure, less than 20 mm mercury. Mass in the neck, especially in the cervical rib, hard, deeply placed, supraclavicular region, non-mobile. And thrill bruit in the supraclavicular phase because it is causing compression over the subclavian artery. There will be poststenotic dilatation and thrombosis. And other tests, important tests, Addison test, rising test like this, Addison's, Allen's test like this, both feeble pulse and see the perfusion, Roos test, hyperabduction test. There are so many tests are there, upper limb specific tests are there, which is very important, which please go through my clinical methods book and SR manual of surgery. That will give you the detail how to examine this patient. Lectures also there for that. That also you can go through that. And how upper limb ischemia is managed, this is also important. Acute type, emergency arterial Doppler and CT angiogram. Heparin anticoagulation should be started immediately, at least to save the whatever the possible tissues from getting thrombosed and getting disturbed. Immediate embolectomy. So critical time is 6 hours. Golden period it is called as golden period. This point is important, golden period, because MCQ they will ask. And within that you have to reperfuse the limb, otherwise the limb will go for ischemia and gangrene. In trauma, early exposure, reconstruction of the artery with or without graft. And chronic time, there are collaterals, ischemia will be there, pain will be there, drugs like aspirin, cilostazol, anticoagulants, lifestyle modifications, carbohydrate less diet, high protein diet, then exercise, all those things, low lipid diet and so on. Percutaneous stenting and angioplasty, And surgery, endarterectomy, bypass graft, sympathectomy, cervical sympathectomy, either through thoracoscopically, that is ideal and better, easier, or through open method, supraclavicular, axillary approach. Different approaches, thoracic approach, different approaches are there, which you can always go through my manual book. Briefly there, and in operative surgery book it is there in detail how to do cervical sympathectomy, both thoracoscopic and open method, and surgical anatomy of cervical sympathectomy is very clearly detailed in my operative surgery book. Please go through that. And surgery for cervical rib, if it is cervical rib, extraperitoneal periosteal resection of the cervical rib is the removal of the first rib with the removal of cutting of the petrolus minor muscle, scalenus muscle, scalenotomy muscle, scalenus anterior muscle, scalenotomy, extraperitoneal resection of the cervical rib, extraperitoneal resection of the first rib, so that widening the thoracic outlet, so preventing the compression is the method, which is the surgery you have to do. And remember, thoracic outlet syndrome is the main question for you. In between short note, all those so many tests are there for upper limb ischemia, that is also short note, please go through that. In oxy they will keep occasionally, they will ask you what is this test, and cervical rib itself is a short note and main question. Surgeries for cervical rib, evaluation of cervical rib, clinical features of cervical rib, different tests, ischemia, upper limb, both sides should be examined. Next examination, examination for the mass and thrill and Bruy, and upper limb examination for wasting, pulsation of the upper limb. Also important clinical examination for cervical rib, don't forget. So for all these things, please go through my SRB clinical methods in surgery. All these tests, how to examine, how to come into conclusion is there with the video lectures, and also my manual surgery given in detail, different methods, evaluation, treatment aspects for upper limb ischemia, including thoracic outlet syndrome and cervical rib, and operative procedure about the cervical sympathetic chain in detail, and upper limb surgeries, amputations, reperfusions, everything given in operative surgery book, and skill by the tissue approximation, of course, in detail, all the video lectures as per CBME syllabus is considered A to Z, surgery, operative surgery, X-ray, specimens, instruments, specialties briefly, urology, cardiothoracic and neurosurgery for undergraduates and also postgraduates. Detailed lectures are available through DigiNor or through JP Publishers. So you can always purchase that for a year, so that you can learn everything through my books and DigiNor as such, and specifically this topic also. So students, I hope you have understood the specific topic, what is called as briefly upper limb ischemia, which is very important.